This is for the week 4 assignment submission for the Ashford University cigarette smoking screencast by Christine B. for the Intro to Health and Wellness. Okay, so for the major health risks with smoking is that smokers are at least exposed for having a stroke, and they are twice at risk for having a stroke. The reason for this is they have an increased heart rate, more so than the normal individual. The heart is having to work double time to pump the blood through the body, according to the NIH. Even the individuals that they live with or around, just by secondhand smoke, they are at greater risk for a stroke. The increased chances of developing lung cancer are also at greater risk when they are around individuals who smoke or for people who do smoke. And another major health risk that comes with smoking is that the life expectancy is reduced at least by 10 years, but sometimes more, depending upon the amount of smoking that occurs each day and how often the individuals smoke throughout their lifetime. Smoking cessation is a program that can be a lengthy process and sometimes a very difficult one in which an individual is helped to discontinue smoking tobacco. These benefits are tremendous to the individual's health in that they reduce their risk of stroke, they have a chance to increase their overall health, and can also increase their quality of life. Although it can be difficult, it is very rewarding and beneficial not only for themselves, but it can also be very rewarding for their pocket, because they're not having to spend so much extra money going out and spending money on the tobacco products, and they can extend their overall, life expectancy and reduce also the costs that is coming out of their pocket for healthcare insurances as well. Smoking cessations sometimes use aids like nicotine patches, nicotine gum, or e-cigs to reduce the use of tobacco. And these can sometimes be, insurances can sometimes prescribe these. Some people can get them over the counters like e-cigs. But use like nicotine patches and nicotine gum can sometimes be prescribed from the doctors to, quit the use of tobacco. If the workplace offers insurances to the company, the healthcare costs can be reduced. If there's a smoke-free workplace, this can cut costs not only for the employees but as well as for the company. There could be less absences due to colds that are brought on by smoke-related illnesses, and the smell wouldn't linger in the clothes of the individuals that work there, as well as the carpets and furnitures, which can keep the place smelling cleaner and keep the furniture and items lasting longer. It's important to live a healthy lifestyle. This includes eating healthy, getting plenty of exercise, plenty of sleep, and having healthy lifestyle habits, which includes not drinking and not smoking. Those who carry these positive habits and modeling these habits and teaching them to others, it's important because, we kind of go around and, when we model these, we're teaching others to have good social habits. And when women are social creatures, and we kind of mirror other habits of other people. It's just we're more wanting to be around people more than men tend to be. But because women are also more likely to have strokes than men, if we're taught at an early age, smoking is not a very healthy habit, we're at less likely to have a stroke than men because of the clotted arteries that, smoking causes. for those who are already at an increased risk, and we're less likely to have interventions later in life for such a case. Thank you for watching.